Hi, this is Charlesetta Tate. I am Community Liaison Director with College Hospital's Outpatient Program. I'm here today with Dr. Clint Salo, who is a clinical psychiatrist who has been working with College Hospital for over 10 years in our partial hospitalization programs. Dr. Salo is a diplomat with the American Board of Psychiatry and Neurology. Today, Dr. Salo will be discussing the highlights and benefits of the partial hospitalization program.
Right. Well, thank you so much, Charlie, for that introduction. And I'm thankful for the opportunity that I have to share a little bit about these programs that are provided through College Hospital. I've had the opportunity to work with these partial hospitalization and intensive outpatient programs through College Hospital for about 10 years. And I've seen my clients benefit significantly from these treatment programs. But just to describe a little bit what you see and what you experience at these programs, specifically the partial hospitalization programs that are affiliated with College Hospital provide very intensive services that a patient can enjoy as they are potentially transitioning from a hospital setting for treatment, or if they feel like they need a higher level of support from a traditional outpatient setting. In particular, when you begin treatment at a partial hospitalization program, the individual or client will typically attend the program anywhere from 3 to 5 days per week. And on those treatment days, they are engaged in group therapy sessions, at times multiple sessions each day. They're able to meet with their case manager, who is really able to provide some supportive therapy for them, but also help them with community integration and allow them to return back to different types of settings and services that they may have received previously. These clients are able to meet with myself or my colleagues that are able to provide management of their medication and assist in adjusting the medication if it is clinically necessary. Specifically, what I've seen, at least historically through the years, is when individuals leave the hospital setting, they can really struggle initially with feeling that they don't have enough support if they leave a hospital setting and return just back to their outpatient doctor, where they may just see that doctor once a month or even less often. But a program like this allows them to seamlessly transition from a hospital setting to a treatment setting where they have a significant amount of support for as little as 3 to 4 weeks to as long as multiple months, depending on the clinical need. And also another situation or set of circumstances where I see a program like this be quite helpful is when an individual is working with their outpatient psychiatrist or their outpatient therapist, and they really start to notice a decline in their functioning. And sometimes it gets to the point where the individual is considering going into a hospital setting. But a program like this can really capture and provide the support that they need before they potentially go into a hospital setting, as again, they are here multiple days per week. And so in summary, in looking at the services that are available, I of course encourage everyone to consider an option like the partial hospitalization program through College Hospital, as it is a way for these individuals to have the support that they need when they are struggling with increased symptoms that sometimes do manifest. Specifically with our partial hospitalization programs, we have multiple treatment locations where individuals can find the services they need. In Orange County, there's different locations that include Laguna Woods, Costa Mesa, Santa Ana, and even Anaheim. But in the Los Angeles County area, we have services in Long Beach, Signal Hill, Cerritos, and even a few other locations. So we greatly encourage you again to seek out and look for these opportunities when you feel like either yourself or a particular loved one is struggling and they need a little bit higher level of support and care. Again, I strongly encourage you to look through services that are available through College Hospital and their associated partial hospitalization programs. Sometimes the question arises as to whether a partial hospitalization program is appropriate for either the individual or for a family member that may be struggling. But I can tell you that we treat a whole spectrum of both mood disorders and even psychotic disorders here at our program. For example, we treat individuals who are struggling with clinical depression, generalized anxiety, associated anxiety disorders, bipolar disorder, schizophrenia, and schizoaffective disorder. We are able to implement up-to-date treatment recommendations, and we're able to work as a treatment team. Both myself, the case managers, program director, we're all able to work together to help our clients achieve their treatment goals. I'm so thankful for the opportunity that I have to work in a setting like this, as I feel significant support from my colleagues, and we're really able to see improvement in the lives of our clients as they make progress and they work toward fulfilling their life, or finding fulfillment in their life that is really meaningful for them.
So how do you make a referral to the partial hospitalization program? So what you would do, you can call me, Charlie, and my number is area code 562-577-6456. And what we do, we'll gather your clinical information, we'll get your insurance, and after we check your insurance, then we'll call you back, give you any updates on your insurance. If you have any outpatient costs or copays, we'll let you know that. And then then we get you in the program. Most insurance companies pay for our program. Medicare, Medi-Cal pays, and then most insurance companies, managed care insurance company pays, but we check that before you come in. Now, the only insurance that does not cover is Medi-Cal only. That does not cover our programs yet, maybe one day, but not yet. So call us, and we'll get your insurance checked, and then we'll call you back, and then we'll get you in the program. Our programs do provide transportation, and so what we do is get you into the program that's nearest where you live so that we can get you to the program at no cost, transportation. So call us, and then we'll get you in. We'll get the insurance checked and get you into program.